Here we go. And yeah, this is meant to be a bit more informal, so people can unmute their mics if they have anything to share, comment, questions, and you can also share any questions or comments in the chat. We don't necessarily have time for everyone to introduce themselves, but if you want to do that in the chat, that would be great so that we know who all is here in the room with us. I hope I can, one moment, I'm going to try, aha, I can also see the chat. Great. Also, if you have any technical issues, having trouble hearing, understanding, want us to go slower, anything like that, feel free to send me a message in the chat. And with that, I will hand it back over to Inas and Zainab, who I think will be taking us through to the other side.
So as you heard from Katie in the previous session, the toolkit has 9 chapters, but in this breakout session, Inas and I will discuss with you chapters 4 and 5. And we would like to have this breakout session in a form of discussion. So we also want to hear from you. You can go ahead and, as Julian said, unmute your mic and talk whenever you want, or write in the chat box. And we will begin our discussion by asking you 2 general questions. So first one is, what do you think are the issues facing adolescents and youth in humanitarian settings regarding their sexual and reproductive health? You can raise your hand if you want to speak, and we'll give you the floor. So in the humanitarian settings, in your context, what do you think are the issues facing adolescents and youth regarding their sexual and reproductive health? Yeah, Inas, go ahead. You raised your hand?
I think I might share some. Yeah, I might share some insights from my side. You know, in Palestine, we have an situation, or let's say, regarding the refugee. I guess in my country, and we have been using toolkits for adolescents' sexual and reproductive health interventions, especially during with the schools within. I think it's really important to have this kind of toolkit developed, especially in light of the really significant importance of having these kind of interventions within the adolescents in a humanitarian crisis. So I just I was thinking how it can be really beneficial to other countries as well, and I'm really curious to hear from people from Pakistan and Iran as well. Thank you, Zainab.
Thank you so much, Inas. So let's hear from Rashid from Pakistan.
Yeah, thank you very much. My name is Rashid, and I'm working for UNFPA as the humanitarian program analyst. So let me quickly share some information regarding these adolescent sexual and reproductive health related issues. Some are cultural and some are like physiological and psychological related. So first of all, like some cultural issues during humanitarian emergencies, which have been which are observed for the last few years during humanitarian emergencies, are like some early marriages were more common early marriages because people were displaced, and just for honor, their parents thought like instead of keeping them at home, is better to arrange their marriage ASAP. So that also led to some early age pregnancies. So this is first thing that happened culturally. Besides this, since there is less awareness around these minority-related issues, like like at the age of 12, 13, when there are when like puberty, the age of puberty starts, and there is no awareness, and particularly hygiene related during humanitarian emergencies, the lack of availability of uh, hygiene kits, or we call dignity kits, that also leads to some infections or even stress, because there is lack of awareness that this is something physiological, something which is a routine. Um, so there is some psychological issues, stress around this. The other thing during humanitarian emergencies, as we have already discussed, is just gender-based violence. That is women of or adolescent and girls of this age are more prone to GBV-related violence. So these are big things I would like to share. Thank you.
Thank you so much, Rashid. Yes, true. And gender-based violence and the lack of hygiene were discussed in the, beginning of this launch and the story that was told about ELO. And for early marriage, yes, working in the field in Lebanon, this was a coping mechanism of some of the displaced population. So if we would like to ask you, how do you think your organization where you're working can use the toolkit in your settings? Askan, you would like to answer? Or you can answer the previous question as well.
Hi, everyone. I was trying to aid to the issues which was mentioned by Rashid earlier. So the adolescent health issues, I have been to some of the responses. So some of them, the issues already mentioned by Rashid, but adding to the issues like he has mentioned about the early pregnancies, so those pregnancies sometimes they lead to unsafe abortion, and that abortion sometimes leads to maternal death or unintentional consequences like fistula. They end up having fistula, which is a lifelong complication and lifelong morbidity for the some of the youth, the adolescent girls are facing. And in some countries or in some context, they are because of the crisis, because of the humanitarian emergencies, they are dropping out of school and they start taking on additional responsibilities, taking care of their siblings, their parents and other things, and they start working as young when they are supposed to be in the school, or they are supposed to be having enjoying their childhood, but they are taking most of their responsibilities. And also he mentioned about the health issues, and some of the contexts, adolescents, they don't have access to reproductive health friendly services or sexual health, reproductive health services. When they are coming to the facilities, the facility is closed or the working hours are not favorable for the young people, and most of the time they come to the facility in the evening or in the afternoon. At that time the center is closed because they come to the facility after school and other time. So sometimes they don't have the friendly providers sitting at the facility to respond to their health issues, because they should be the behavior, the attitude and the services should be young or youth friendly, and most of the time they are not available in those settings. So some of the issues related to the access to services, some of them are lack of services, and when there is access, but sometimes you have access but there are lack of services, or the services are not of quality to use those services. So those are some issues I have seen during my deployment in the humanitarian settings.
Thank you so much, Khan, and I'll hand over to Inas to talk to us about chapter 4, and we can also answer, the second question again with that chapter.
Thank you very much, Zainab. I just want to ask a quick question to Skam. Where are you from? Are you from Pakistan as well?
To me, yes, I'm from Pakistan, but I work for Save the Children
Okay,
US.
so we, yeah. Okay, slide 2. We will discuss chapter 4 as mentioned before. So starting with chapter 4, priority, this chapter missed, which is the minimum initial service package for reproductive health in crisis situations, a chapter of the interagency field manual on reproductive health in humanitarian settings. When implementing the MIST from onset of crisis, it saves lives and prevents illness, especially among women and girls. I would like to ask everyone in the room if you have ever or you are using currently the MISP within your work and your interventions in the emergency regions that you work in. Does anyone have ever worked with the MISP? Yes, please. What do we have? Mr. Rashid, you can go ahead.
All right, thank you very much. And as for last 2 years, our emergency response we called it winter emergency response #1, and earlier to that was drought response in 2 areas, 2 provinces, and another third is like it's a integrated SRH and GBB for a protected crisis for Afghan refugees in Pakistan. So we have been implementing MISP, and we started actually with MISP. Initially, we started with MISP, and gradually we integrated these services into the for these guidelines, the objective 5. We integrated these services into comprehensive SRH and GB services. So yes, I've been implementing MISP over the last 2 years.
That's great.
3
That's great.
consecutive emergencies.
Actually, great. Actually, maybe if you ever use the MISP, so you can you will notice actually the importance of this chapter or the additions that it will add on the MISP, because while the MISP recognizes the importance of adolescent inclusive approaches, however, it does not address all the needs of adolescents, nor provides guidance on how to do so. So the ASRH Toolkit for Humanitarian Settings, this toolkit, the 2020 edition, is a companion to the revised AIFM and MISP, providing practical tools and resources on implementation of MISP. So actually, if you are using MISP and you want to use the toolkit as well as an addition, you will definitely need to focus on chapter 4. The Adolescent's inclusive MISP ensures that even during emergencies, we provide adolescent-friendly services. The Adolescent inclusive MISP has tailored activities specific to the SRH needs of adolescents, beginning in the chapter 4 and extending through the rest of the toolkit. So it's really beneficial for you to go through chapter 4 to enhance your work with the MISP, and not only Mr. Rashid, of course, everyone who uses the MISP and is willing to use the MISP as well. So in this slide, I would like to ask if any one of you can share insights on how do you think your organization will use the guidance and tools from this chapter. As I explained, it gives more additions to the MISP. And how can you transition to comprehensive SRH services in an emergency? So I really would appreciate your insights. if you already used the MISP, so maybe you can reflect on what were the adolescents, if you ever felt that the MISP wasn't really pointing out some stuff within your organization. Okay, yeah, please go ahead, Dr. Rashid, Mr. Rashid.
All right, thank you very much. I'm sorry, I'm feeling like I'm talking too frequently, but I would like to give chance to my other colleagues as well. Besides implementing MISP guidelines, and I'm sure most of it is like most of these ASRH toolkit will is aligned with the MISP overall guideline, those 6 objectives. But what I'm expecting more in this particular toolkit is considering these cultural sensitivities, talking about adolescent young girls' sexual health issues in the community at the time of a disaster, humanitarian emergency. I'm just keeping that scenario in my mind, and I'm expecting some communication guidelines in this toolkit on how to talk to general public, people who are in disaster, who are affected at that time, who are displaced, how to talk to them around these particular adolescent sexual health related issues. Say, for example, if a team in the field is creating awareness or sharing some awareness messages with the community on like this menarche and early puberty and pubertal changes related issues. So most of the time it is culturally sensitive, and we always expect, a big fire from the community. So there must be some approaches I'm expecting in this particular guideline. And similarly, when we distribute these dignity kits, which contain hygiene items, for example, hygiene pads, again, like what we currently did in order to avoid, in order to protect our field team from a community's reaction. What we did, we kept it as a package. We provided it as a package to women who were attending women-friendly health spaces. So that was kind of a confidence building in my area. Women are attending these. These are some places of to enjoy some leisure time, to attend some recreational activities, and during that we arranged distribution of these particular hygiene kit items to those women in women-friendly health spaces. So maybe that can be the same place can be used to discuss these adolescent specific issues. But maybe you can share more information on how this ASRS toolkit is addressed this particular.
Thank you. Thank you very much. Thank you really very much for your addition and your input. It's really important to hear from practitioners in the field. What challenges did they face, especially with approaching young people and adolescents in humanitarian settings? And it's really important that you highlighted this challenge of how we can approach adolescents. And it's really, this is exactly what was noted in the previous edition of the toolkit and the MISP. And that's why this edition, we have this chapter that talks about the priority ASRH in emergencies activities. So to share any insights on this chapter, I would like to pass over to my colleague Zainab to start discussing chapter 5, and I would really thank you for discussing chapter 4, and I would also encourage you to go through chapter 4 if you are using the list. Thank you. Over to you, Zainab.
Thank you so much, Inas. So chapter 5 is about going beyond health services, meaning that to fully meet the unique SRH needs of adolescents, we must find entry points for SRH programming within the entire humanitarian response by looking at factors that will help and or hinder adolescents in accessing and using SRH services at multiple levels. And this includes individual, interpersonal, community, and structural. These levels are part of the social ecological model, which chapter 5 explains in details. For example, at the individual level, you have biological and personal attributes, attitudes, beliefs, and experiences of adolescents. While the structural level refers to the infrastructure and systems surrounding adolescents. Their ability to obtain information and services is influenced by the availability of health facilities, the safety of their communities, as well as by policies and laws that restrict or support access to SRH services. So again, we would like to hear from you. How do you think your organization will use this guidance and tools from this chapter? And as Julian said, you can share with us your experience in the chat, or please go ahead and unmute your mic. So we have John from the Philippines, and he says that they're committed to use the cash voucher assistant as default support.
Maybe this kind of question we can move to the joint room to ask.
And Julian just answered you that there is no specific guidance on CVA, but certainly tools that could help support implementation of similar programming. So some examples on Scan, yes, you would like to give us your contribution? Go ahead.
Yeah, I was expecting. I'm expecting from this toolkit, like it might be useful for us how to integrate effectively with other sectors like food distribution, like child protection, child safeguarding, or other sectors and WASH sector. So how to integrate effectively with those sectors and to identify the entry points for the young people, for the adolescents to come to your facility to avail those services. So I'm expecting some kind of tools or that are available in this ASRH tool, so that would be helpful to effectively integrate.
Thank you so much, Scan. Yes, that's exactly what Chapter 5 will be discussing. Anyone else would like to tell us? We would also like to know, yeah?
I'm always up to share as well, Zainab.
Yes, go ahead, Ina.
Well, actually, I mean, based on my really very small experience, let's say, in the field, I think it was really challenging to know what is exactly the suitable approach to reach to adolescents. I mean, sometimes we have this very straightforward thing is to go to schools within with partnership with the Ministry of Education, for example. But sometimes you can't go to all schools. You can't target all schools. You can't I don't know, maybe sometimes it's really hard to get a partnership with the Ministry of Education for some reasons, maybe societal restrictions or somehow. So I think I am really interested to read chapter 5 and to read more about how we can approach young people and adolescents in other ways. And sometimes even if you approach them through schools, sometimes they kind of have this kind of individual restrictions that they cannot receive they don't they're not willing to receive any SRH services. So maybe that's why I'm interested in chapter 5, to know more about the different levels of how we can approach young people and adolescents.
Yes, very true, Inas. In a project that I worked on in Lebanon, and we were trying to partner with the Ministry of Education, but it was very difficult. And before we were able to get the permit, we had to find other ways to reach out to adolescent girls. So we discovered that they're taking extracurricular activities and also like extra lessons in some community centers. And this was our entry point.
Yeah, it's really important to know what is exactly the entry point.
Yes. So, and also we would like to know, so how can humanitarian agencies use the toolkit to help their organization and other partners, including government partners, to coordinate effectively in responding to the SRH needs of adolescents in emergencies? So, for example, under the structural level in Chapter 5, there's a section called Humanitarian Coordination and Leadership, and it provides different response strategies to overcome some of the challenges related to the coordination. Would anyone like to share his or her experience working in the field regarding this issue? So some examples would be, for coordination to include and empower adolescents, integrating adolescent and youth networks and organizations, like the example I just mentioned, where we had to reach out to community centers in order to reach adolescents. And then at the next stage, we were able to meet with their parents and have multiple meetings with the parents and with the adolescents, and also there could be meetings and inputs for the humanitarian needs and humanitarian response plans. So we have also another question in the chat that we will raise in the plenary. Inas, would you like to add anything regarding Chapter 5?
I guess from my side, as I told you, I'm really excited to read them more and to get the real positive use of the toolkit, especially for Chapter 5, since it's really challenging for us in Palestine to reach out to adolescents for several reasons. So I believe that chapter 5 will give really good insight on how to approach adolescents in different situations and on different levels as well. So yeah.
Yeah, I think it's also relevant in our current situation during the pandemic.
Yeah, it's really relevant because suddenly we have everything online, and adolescents were really hard to be approached during the pandemic and the online events. It was like you cannot guarantee their presence in the online events. We faced that in even schooling, so it was kind of a challenge.
Yes, and then organizations had to come up with, had to shift their programs online and had to come up with plan A and B in order to reach out to adolescents. And this is part of the structural factor that could help or hinder adolescents. So,
especially if we're talking about in humanitarian settings,
yes.
Sometimes it's the lack of the internet. To have the internet service in the pandemic is really challenging.
I'm curious to know if any of the participants has anything to share regarding this. Accessing SRH or shifting programs during the pandemic.
Do we have actually participants from Iran?
Maybe not.
So we have 2 comments in the chat. Yeah.
Yes, of coordinating with the educational system is very important, and we were discussing that. And Sarah was telling us that she used to work for IPPF, and one way the organization worked for including young people in coordination is to include them in cluster meetings. That's great, and some of IPPF's member associations did that. It's true that we should include young people in the decision-making process and involve them throughout the process. It's one of the themes that we keep on repeating again and again. They have to be part of the decision-making process.
Here in Palestine, we also use the health sector. We use the health sector as an entry point in many cases, because in schools we are sometimes prevented to go in schools. So we sometimes have to go to coordinate with maybe like a local clinic or something, that we can have kind of interactive sessions with adolescents that includes awareness on sexual and reproductive health. It was really challenging to go through, sometimes education, sometimes the medical sector. So it's reaching out to adolescents is quite challenging in my country, in my situation.
So we have 2 minutes left. Do we have any final comments? Khan, yes, please go ahead.
I was thinking to have one of the challenge is maybe this, I have to go through all the chapters. Maybe this toolkit will be answering some of the questions, like how to approach or engage or to give like a meaningful participation for people with the special needs, like the young people with the special needs, with the disability, with other special needs. So hopefully I'm looking forward to the whole ASRH toolkit. There might be some tools to how to approach, how to engage, how to coordinate with those groups of young people. So I'm looking forward to it.
Well, thank you so much, everyone. I think this brings us exactly to 40 minutes in our group. And yes, I hope everyone can stick around for the plenary or for the closing when we go back to plenary. I think we will be all automatically moved back, so you don't have to do anything else. Okay.